A petition has been filed in court challenging the newly enacted Social Health Insurance Act. The petitioner, Dominic Orio, argues that the mandatory 2% from employees is excessive on Kenyans who are already burdened with taxes and deductions. Mr. Orio argues that the new act is unclear, adding that it does not provide mechanism and reliable ways to identify members. He further argues that it's unclear how the health scheme will be financed through premium contributions, which are unreliable for healthcare resource mobilization in a country with substantial poverty. He says that the law fails to articulate ways to collect revenue from the informal sector which are practical. The petitioner further says that failure to transfer NHIF employees to the newly established fund is discriminatory and might lead to loss of jobs. The petition comes after President William Ruto on Thursday signed 4 universal health coverage bills into law. The 4 bills include the Primary Health Care Bill, Facility Improvement Financing Bill, Digital Health Bill and the Social Health Insurance Bill. This now means that Kenyans employed in the formal sector will make a monthly contribution of 2.75% of their salary, capped at a minimum of 300 and a maximum of 5,000. Speaking at the 60th Mashuja Day celebrations held in Kericho County on Friday, President Ruto defended the move, saying that every Kenyan will pay according to their income. Ruto insisted that by enacting the 4 bills into law, healthcare access will no longer be determined by financial capacity but rather by the healthcare requirements of every.
The Constitution guarantees Kenyans the right to the highest standards of health. Since independence, successive governments have made efforts in guaranteeing access to quality and affordable health care for Kenyans, but with limited success. There have been several attempts and efforts to achieve universal health coverage, one in 2003, in 2013, and in 2018. However, these efforts were met with little success. It is for this reason that the government of Kenya identified healthcare delivery as one of the core pillars of the bottom-up economic transformation agenda. In the Kenya Kwanza Manifesto, we made several commitments towards the delivery of universal health coverage. These include the provision of a fully public financed primary health care, the installation of a digital health management information system, and the setting up of a fund for improving healthcare facilities across Kenya. Other commitments were the setting up of an emergency medical treatment fund, the establishment of a national insurance fund that covers all Kenyans, and the availability of medical staff who deliver on this great universal health coverage that has been in the works for a long time. The government has instituted a paradigm shift to preventive and promotive health rather than where we've been at curative health. This approach also makes economic sense. Community health reports state that for every 1 shilling invested in community health, 9 shillings and 40 cents are realized in economic and social gains in our society. In our plan, delivery of primary health services at community level will start with community health promoters. And we are very proud that they are represented in large numbers today in this very important Mashujaa Day. The work of the promoters will include basic preventive and promotive health, health education, basic first aid for the treatment of minor injuries and ailments at household level, and referral for facility-based health care.